Urinary tract infections, UTIs. Although more common in females, UTIs can affect males as well. They occur when bacteria enter the urinary tract, leading to symptoms such as pain or burning during urination, frequent urination, and urgency to urinate. Benign prostatic hyperplasia, BPH. BPH is a condition characterized by the non-cancerous enlargement of the prostate gland, which can cause symptoms such as frequent urination, difficulty starting or maintaining urination, weak urine flow, and the feeling of incomplete bladder emptying.
Erectile dysfunction, ED,
is the inability to achieve or maintain an erection sufficient for sexual intercourse. It can be caused by various factors including physical conditions such as diabetes, high blood pressure, or psychological factors such as stress or anxiety. Prostatitis. Prostatitis refers to inflammation of the prostate gland and can be acute or chronic. Symptoms may include pain or discomfort in the pelvic area, difficulty urinating, pain during ejaculation, and flu-like symptoms. Kidney stones. Kidney stones are hard deposits of minerals and salts that form in the kidneys. They can vary in size and may cause severe pain in the back, side, abdomen, or groin. Other symptoms may include blood in the urine, nausea, vomiting, and difficulty urinating. These are just a few examples of common urological problems in males, and it's important for individuals experiencing any urological symptoms to seek medical advice for proper diagnosis and treatment.